Good morning, everybody. Finally, if you're still around, you may have given up. Forget it. They aren't going to do anything this morning. Or you may go, oh, yeah, finally, here they are. They must have been, and you're off doing anything anyway. So you were doing what we call divided attention. If you have that capacity, you might have been doing something else on the computer. And when something happens over here, there they are. They are on. So some of you will be watching this recorded. Some of you might still be looking live. And so I shall do the reveal. Here is the result of having Thursday last week removed 8 lower teeth that were already destroyed, basically, and were not going to be able to be, there was nothing they could do further. No molars left because I've had horrible teeth my whole life, and I've gone through lots of dental stuff. So what you see is not only did I have teeth removed, I had implants. So 4 implants put in, metal posts put in. And then they created a bottom set of teeth that will be permanently installed, an arch. And they put it all in on Thursday. So from 7:30 in the morning to 3:30 in the afternoon. But frankly, the biggest challenge, and it's a little bruised still, and it's a little still not the best as far as mobility goes yet. I haven't quite mastered all the skills of working with this new set of bottom teeth, because before I had a bridge that had molar substitutes on each side, and it was locked onto the remaining teeth, which is where some of the problem was. And I still have my uppers to have to deal with. But really and truly, the biggest issue is the bruising, which you see in the swelling, and the fact that I got Valium before, because they want you relaxed beforehand. But I have really strong reactions to medications. And so I had true double vision, which I haven't had for, I don't know, probably when I was sick another time. But truly seeing 2 of things and having a hard time, and therefore having difficulty with balance and movement, and then nausea. So when that got out of my system, I actually felt pretty good, and I haven't had any issues with severe pain. So that's good, because that's sort of what also leads to the problem, is my lack of awareness of pain sometimes, which allowed abscesses to happen. So more than you wanted to know. However, it leads us into what can be a gem state of curiosity, or a gem state of problematic. So here's how we're going to start. Classically, this is where people would start going, okay, something going on here. This is not just mom being mom and a little bit extra. This is not just my husband being stubborn. This isn't just that they're not listening to me. This is not that they're not even trying. This is something more. And so this is the point where if you were using global deterioration scale, you would say something like, wow, they're a stage 5. So I want to read out what stage 5 says, because I want to be real clear, sort of thing, of what they're talking about. And then we're going to take a look at a video, because I want you to meet somebody who clearly has been identified after a long period of not letting her know that she was living with dementia, young-onset Alzheimer's. And it's Joanna Fix, a friend of ours, who readily speaks up, steps up, and speaks out about living with Alzheimer's disease. But what I want to do is I want to read you the description of what global deterioration says, because I want to be real clear. The problem I have with this language is the language. And the fact that this was done back in the 1990s, 1980s, and has not been updated, and was only done for a specific set of Alzheimer's later in life, which means it misses some of the early onset symptoms that might in fact indicate that you've progressed to a place. So let me read this for you, because I have to read it, because I would never say some of these words. So I have to work on the words. Okay, here we go. So this is where this is number 3, mild cognitive decline. Okay, earliest clear-cut deficits, objective evidence of memory deficit obtained only with an intensive interview conducted by a trained geriatric psychiatrist. Concentration deficit may be evident on clinical testing. Patient may demonstrate decreased facility in the following. A, remembering names upon introduction to new people. B, retaining information after reading a passage from a book. Decreased performance becomes manifest in demanding employment and social situations. Examples can include the following, colon. A, coworkers become aware of the patient's relatively poor performance. B, difficulties in finding words and names may become evident to intimates. C, may lose or misplace an object of value. D, getting seriously lost when traveling to unfamiliar locations. Period. Subtlety of the clinical symptoms may be increased by denial that is often becomes manifest with these patients. Mild to moderate anxiety also accompanies the symptoms. Typically, when a patient is forced to cope with challenging employment and social demands, they find they can no longer negotiate. All right, Matthew, just right off. Okay, so
I'm in trouble, Teepa. I think I'm in trouble because there's some of the stuff you said there, I feel like I have experienced, or and some of it I'm like, tell me more about what your definition is, because like the definition of seriously lost. Okay, so my definition of seriously lost could be different than your definition of seriously lost. I mean, so it's left me feeling more curious and wondering what and than anything.
Like not being able to remember a name of somebody you just met. It's like, unless you actively work at it, good luck on that, especially when you're meeting several different people or reading a passage and then going, oh, shoot, what was that? Did it say you should or you shouldn't do that? Wait a minute, let me look at it again. Yeah. How many of you have had to verify information? And then that only a geriatric psychiatrist could evaluate you for this?
Yeah. Wow. Interesting.
I am like, here's the problem. If you don't have a baseline on somebody, I don't know how you're going to determine if this is just how they are, like they've never been good at this stuff, or this is something new. So, and the emphasis on memory, which is now they did say direction finding, apparently, sort of in the background, but sort of minor. So I want us to meet Joanna Fix. Okay, and I want you to, and Joanna has been living with her Alzheimer's for, I think at this time, I think it was about 8 years or so, because she had been diagnosed, and then we had worked together, and she volunteered to do the Courageous Conversation. Yeah. So let's hear what she has to say here for one of our conferences.
So Joanna, the topic for today is looking your best, being your best. And I have a curiosity. What does that mean for you these days as compared to what it would have meant when you were teaching at university? Because there was a time you were teaching classes at university and doing some consulting for forensic psychology. What did it look like and feel like then? And what about now?
So what it looked like then when other people were looking at me, it took longer, that's for sure, because I made sure that when I looked in the mirror that there wasn't anything wrong, that there wasn't any hair out of place or spinach in the teeth or booger in the nose or eye makeup, that everything looked normal and acceptable and my outfit was good and matched. And those, I was happy that I was able to do that. I was able to be put together, feel put together, and I felt confident in my appearance.
Okay.
Okay.
So you really would spend time making sure you looked the part you were going to play.
Exactly, right. I'm not going to wear the sweatpants I wear on the weekend out in the yard pulling weeds. I'm going to make sure I don't smell sweaty and I have everything put together because I don't, I want to be acceptable and received well in my profession.
Yeah. So
let's pause there for just a second. So as you're listening to Joanna's description about what was important to her back when she taught, does that sound more like a sapphire or more like a diamond? Oh, let's review what diamond means. Okay, I'm going to pull up my trusty quick card. And if you want one of these, we have these available. Clear, sharp, many facets, gardening with sweatpants versus, and all the details about it. Lives by habit and routine. Likes familiar, really dislikes change. Blames or dismisses errors, or blames the blame thing. Short delays possible. Okay. Word finding difficulties or changes. Can shine and can cut, and has scuba vision. So that's how we describe someone in this state. Now that's a little different. So we talk about someone who's clear and still sharp, someone who has lots of different appearances depending on where you encounter them and how you encounter them, and how they encounter the world. And also looking at habits and routines. And as long as you can maintain a habit and routine and it's working for you, it goes well. And then liking what you know and not liking what you don't, wanting to appear, wanting to be a certain way and making sure you do that. And then when there are errors, well, then that's not okay. That's not going to be all right. And depending on how aware or unaware you are, you may either dismiss them or you might blame them on someone or something else. And a little word finding difficulty, mostly just little stumbles or little hesitations. But still can both cut and shine. So what do you think, Matthew?
Yeah, definitely. I'm feeling more diamond skill here, what I'm hearing, not just from her procedures, her routine prior to, but even in this moment, listening to Joanna, trying to bring those pieces up, trying to talk through all of those steps and all of those things. And she gave a very clear signal at the end of it. She goes, okay, and like took a deep breath and said that after he said, yeah, you confirmed, yep, that's exactly what I was looking for. And she felt satisfied that, okay, I gave the right thing in this moment. I actually gave what you were looking for.
I did what you were looking for. So now I feel that same kind of like I met expectations. Check. Sure. I am in a good space. Let's see where it goes next. Let's see what else we talk about here.
Part of being acceptable and being identified as excellent is how you look and how you smell and how you come across. And so fitting into that mold is really, it's something you learn to do if you're going to work in academics and you're going to be a consultant. I mean, it's what people do.
Yeah, I didn't enjoy wearing suits. I did it because I enjoyed my job, and that was a requirement to be taken seriously and interact.
So looking your best then meant fitting into a box or a form or an expectation, and you were good at it.
Oh, and I enjoyed it. I was happy to do it. Yeah. I loved what I did.
Yeah, so getting dressed was just a piece of the puzzle. I mean, yeah, you just did that so you could go do the thing you love to do.
Right.
And there was expectations about it. So nowadays, looking your best.
Right there for a second, Matthew. Because I want to emphasize, Joanna was really sapphire in that life. And I want to emphasize that. We call it sapphire, but flexible and whole, because she knew that that was the expectation. And she didn't mind doing it because she loved doing the things she got to do when she did all that. When you look your best, when you're all dressed to the nines, when you put on the suit, when you do that, you are able then to speak with authority, to lead classes, to be respected. And she got that. So that is a sapphire state. But her description where she went with that was definitely more in the little rigid, little inflexible. Make sense?
Yeah, and I'm also noting a little bit more on that amber gem state side, because I know often we talk with amber, that's when that curiosity, more driven by curiosity than safety, and that sensation, if it's something I like, if it's something I enjoy, I'm going to do more of it. If it's something I don't like, I'm not going to do it. So noticing too, that pickup of that could be that amber gem state moment for her. This is uncomfortable. I don't really like wearing these things, but her ability to shift into sapphire and be like, hey, but if you want to do this and you really enjoy doing it, here's what you have to do to be able to do it.
Yeah.
And being able to do that.
Being able to do that. And so what we'll notice now is I'm about to talk about what about now for you. So let's see where Joanna takes it now, given where she's at.
Me with senior helpers in Denver, Colorado.
Oh,
And
that's right.
I tell you, you look so much better than I did. I'm like, wow, you are super put together. I mean, you look like you were going to do the consult or the class. I mean, it was really a class act. You look fantastic. We have pictures. I'll make sure everybody sees the pictures.
Thank you.
You're really like, wow, you clean up well. My curiosity is, other than that, I mean,
because when I gave her the information about the conference she and I had done shortly before, not too long before this, her brain went, oh yeah, I remember. That's not Alzheimer's, where she would have gone, what are you talking about, a conference? I mean, that's not what she did at all. Her brain went, oh yeah, we met in, that's right. Ta-da. And so it was a connection that was weak. But it was not a missing connection. So again, here we see the genuine laughter of like, oh yeah, I did look better than you. Not in a mean way. Because she always looked better than I do. It's all true. So I just want to point that out. How, well, so if I was the clinical psychiatrist, what would I say? Oh, well, she's fine. She's 8 years out of a job that she loves. She can't hold that job because of the changes, but she can sure still deliver a content piece. She can deliver a lecture. She can be part of Echoes. Joanna, to this day, still has so many confidence moments. And that's why we believe that it's about a gem state, not about this level or stage that people are in. That's nonsense. I mean, it just truly is nonsense. There are no hard boundaries. We go back and forth. And in this interview, if you choose to watch more of it, you'll see more back and forth. Because, yeah, Joanna can only take a shower every so often. She has to really focus on how do you frigging wash your hair? What do you do to your hair to do this? And if she does that, she can't do anything else for the day. She's out of juice. She gets it. Why is it the system has such a hard time recognizing this is not a concrete put a people in a box and put them there, leave them there? That's just not how this works. And what it means is we have to be flexible. We have to be willing. Those with capacity have to choose to use their capacity, whatever it is. And if we will, one way or the other, and sometimes when we don't recognize we're doing it, we cause more harm. And it's not care. It's abuse or it's neglect. And I want us to get really super honest with ourselves. Do I need help? Do I need support? Do I need more than I have? Because I myself am recognizing, wow, I have a hard time staying in sapphire state when it's in this moment with this situation. I really do. And I need this to change so I can do that. Matthew, thoughts from you before we recognize this thing that we have. The card, it's a starter. The book, it's more. I mean, we've tried really hard to make sure, and we've updated this, unlike global deterioration, which is still using the same scale that was first created. Honestly, this was just updated because our language, our beliefs, our understanding, the state of the art, state of the science has really dramatically changed. And because of that, we need to include things like Lewy body and FTD, and we need to include things like late. We need to recognize, wow, not everything looks the same. It isn't the same.
Yeah.
So let's be smart.
Yeah. Yeah, Teepa, I love how all of these resources, everything we've talked about, everything that you've created and the team has created, the idea of truly just noticing the person in the moment and their skills. Yeah, it's nice to know diagnosis. It's nice to know what else is happening. But the idea of truly in the moment, noticing somebody's skills and abilities and us it hopefully in our true sapphire gem state can shift to match, and the difference that makes, leaving all of the other stuff behind, but that idea of truly recognizing in that moment and what that takes to get there, that being such a huge difference that we hear from a lot of people out there, is that being able to be in the moment, being able to do that, and how much of a difference that made for them in their relationship.
How much you pull back, you do your pause, you really do think it through, you use your pipes, you really are paying attention to your 5 Ps. What does that mean, really? It means this year is our first year where we really are requiring, if you want to move forward within our system into certification, higher order certification, you've got to make choices. And then you've got to follow through on those choices. So if you want to become a champion, take the champion course. But then if you really want to demonstrate you've got it, so you can be a role model for others, you'll need to do the pin check off, because it allows you to get feedback on exactly on what you think you're doing versus maybe what you're doing. Short little videos, but boy, could it make a difference when you look at yourself with those eyes, where you're able to see yourself, hear yourself, look, and really pay attention, because we will need that. This is not about putting people in boxes. This is about supporting one another as we move this system into the next generation and recognizing, wow, we've got work to do. And it's hard work, but it's doable. So,
and I will put all of the links in the chat to everything we talked about today, so you can go find all of what we talked about, because how else do we start? How else do we get moving forward with this change? One step at a time, one small bite at a time, and checking out what matches with where
you are. Look at where you are and where you want to go. And if all you want to do is watch more of Joanna's conversation with me, we have also that courageous conversation available. We have also from the conference that we did, there'll be more available there. So we work hard to try to make things available. And the reason we do that is because we believe that we've got to radically change what we're currently doing. And the old system doesn't serve people well. And it will serve better if we're willing to be flexible and knowledgeable and skillful. But it means we've got to change. That's what it's all about. Keep your brain healthy with brain change. Till next time, take care of yourselves. Take care with your care. Thanks, everybody.
Thank you, Teepa. Bye, everybody.